So today we are going to study about the abnormal uterine bleeding or the atypical uterine bleeding. So here first you should study about the definition of the abnormal uterine bleeding. Abnormal uterine bleeding means it is defined as a bleeding that is from the uterine corpus, that is the bleeding from the body of the uterus, that is the uterine corpus. And what is the peculiarity of this bleeding? It is abnormal in duration, volume, frequency and or regularity. Okay, that is mainly seen in a non-pregnant woman. So that is the abnormal uterine bleeding, and there is chronic type of AUB and acute AUB are there. Okay, so that's the first thing you should study. So abnormal uterine bleeding means it is any bleeding that is deviating from the normal characteristics of the menstrual cycle. So that is the abnormal uterine bleeding. So what is normal menstruation? Normal menstruation means normal menstruation bleeding is defined as cycles that occur every 24 to 38 days. Okay, so that's the normal menstrual bleeding, and with duration of up to 8 days. Okay, so that's the regular menstrual bleeding. Okay, and so we need to, so this one is a normal and abnormal menstruation box. You should study this. So normal, the frequency will be less than or equal to 24 to greater than or equal to 38 days. Okay, sorry, it will be greater than or equal to 24 days to less than or equal to 38 days. That's a normal frequency. Infrequent means it is greater than 38 days, and frequent means less than 24 days the periods is coming. Okay, so that the first one. Normal, infrequent, frequent, and last amenorrhea means absent menses. Menses is not there. And this is duration. The normal duration is less than or equal to 8 days. Okay, and prolonged means greater than 8 days, that is duration. And next is regularity. Regularity means regular here, shortest to longest cycle variation. Okay, there will be a variation, but the variation is like for regular cases it will be less than or equal to 7 to 9 days. Okay, that will be. In case of irregular, the shortest to longest cycle variation will be what? A greater than 8 or equal to 8. Okay, up to 10 days. That's the irregular, that is the variation. So in case of 18 to 25 years, it will be like less than or equal to 9 days. Okay, less than or equal to 9 days. But in case of 26 to 41 years, it will be less than or equal to 7 days. And in case of 42 to 45 years, less than or equal to 9 days. So that's the regularity. So frequency, duration, regularity. Last one is the flow volume. It is like light, normal or heavy. Okay, so that's, so if there is any variation in these type of that, if it is like coming frequently, or the duration that prolonged for menstruation, or the fluid volume increases like heavy bleeding, so like that comes. So what is heavy menstrual bleeding? Heavy menstrual bleeding means it is defined as the excessive menstrual blood loss that interferes with, okay, excessive ആയിട്ട് blood പോകുന്നതിനാണ് നമ്മൾ heavy menstrual bleeding എന്ന് പറയുന്നത്. And it can be defined as the it will interferes with the woman's physical, social, emotional and the maternal quality of the life. Okay, and other things are, what is intermenstrual bleeding? Intermenstrual bleeding means it is a bleeding between the spontaneous predictable. നമ്മൾ predict ചെയ്ത് നമ്മൾ കുറച്ച് മെൻസസ് വെച്ചിട്ടുണ്ട്, നമുക്ക് കറക്റ്റിന് ഇന്നാവും. അപ്പോൾ അതിൽ it is the intermenstrual bleeding means it is a bleeding between those spontaneous predictable menses. Okay, അത് randomly occur ചെയ്യാം, or it can also occur like predictably or cyclically in early, mid or late cycle. Okay, and what are the main causes for intermenstrual bleeding? Mainly structural causes are like what? Submucous fibroids or polyps. Okay, or in case of cervical pathologies like cervical polyps or cervical erosions, okay, or CAN and cervical cancer, all are responsible for this intermenstrual bleeding. But in case of submucous fibroids, okay, submucous fibroids can cause both heavy menstrual bleeding and also this intermenstrual bleeding. Okay, so whenever a patient says intermenstrual bleeding, you should think like the cervical pathologies like cervical polyp, erosions and cervical cancer, and structural causes like polyps and submucous fibroids. Okay.